Hello friends, welcome to my YouTube channel Kavita Nursing Note. So today we are going to discuss the second part of CAD. If you guys have not yet visited my first part, you can go through that so that you can better understand this part. So in first part we have revised about the coronary artery disease, which is mainly happened in our coronary artery of heart, where there is a blockage formation due to the buildup of plaque and high cholesterol level, which is called as atherosclerotic formation. And in first part we have read about the causes due to high blood cholesterol, triglyceride, genetic, some immune response and some diabetic causes. So please guys, if you have not yet visited, you can go through that. So let's start the video. So in second part we are starting from clinical manifestation of coronary artery disease. What are the signs and symptoms which we will see in CAD? First symptom is our angina, and we can call it as a angina pectoris. This is the most common symptom of heart disease. Okay, this is the most common symptom of heart disease. In this angina there is a pain formation in chest, which is a throbbing sensation pain. It feels like some heavy weight have been put on our chest, and it's a burning sensation which you can feel on the chest. Okay, next symptom is our dyspnea. Dyspnea means a type of shortness of breath. Patient will feel a breath deprived. He feel that the breath is not coming. Next symptom is our discomfort or pain in our shoulder, neck, abdomen, belly or back. Due to the lack of oxygen and nutrition supply, and mainly the heart pain which we can see in our left shoulder, mainly neck region, in the abdomen, belly and back region. Next symptom is inadequate cardiac output, as the cardiac output is low because the coronary arteries get blocked due to the atherosclerosis formation, plaque formation. So the output of the heart will get reduced because the coronary artery get narrow. Okay, next symptom is our diaphrosis, means patient will feel excessive sweating. Okay, even though he is not doing any work, he will feel sweating. Okay, fatigue will in patient, because of lack of oxygen and nutrition supply, the body cells will start to get die, and there will be weakness happen due to the lack of blood and oxygen supply. Arrhythmia, next symptom. Arrhythmia means a heart rate is not properly in a proper manner, means there is an increase of heart rate, or either it can be decreased of heart rate. It is not in a regular form. The rate, rhythm and formation of heart rates are completely get changed. That is called as arrhythmia. Next is our high levels of cardiac enzyme. When the heart will not able to get oxygen supply, the heart muscles and cells tissue get die. And when the cardiac muscles, mainly our myocardium cells will get die, then it release certain forms of enzymes at the time of heart cell die, like our we can say that CKMB like, and our troponin T and troponin I. Okay, and there will be changes in ECG. Okay, now let's discuss with the diagnostic test. What are the tests we can go through that? Okay, firstly we will do medical history and physical examination. It is the most important for almost every disease. Mainly for the heart disease we are doing medical history, because the heart disease is genetic. Okay, it can go through in generation to generation. It is a hereditary form of disease. If somebody in family is having high level of BP, high level of cholesterol and triglyceride, there are more chances of disease to get spread in their generation. Okay, in physical examination, your doctor might check your pulse rate, heart rate, rhythm, how you respirate, and through the stethoscope placed on your chest through the auscultation. So mainly in physical examination, he will check you from head to toe. Okay, next test is our electrocardiogram. Electrocardiogram can be called as EKG-gram. It's a graphical form of presentation in which the electrical activity of the heart is noticed in a graphical form. Means the signal which are coming from SA node and going through the AV node, which are mainly for the contraction and relaxation of heart, we can note them in a graphical form of paper, which is called as electrocardiogram, the heart rhythm and rate of our heart. So next is our Excise stress test. This test is done when we can check that is our heart doing proper action or pumping blood sufficiently when we are doing a heavy work. Means when the patient having a stable type of angina, in which he is doing more emotionally, patient is suffering from more emotions, he is doing more activity, is then heart is properly functioning or not. In this test, we can place the patient in a treadmill and then we can check and record his ECG or EKG. Okay, next test is our echocardiogram. Echo, it means we are sending some sound waves to see the heart functioning in proper way or not. A sound waves will show the valves are working properly or not, the heart is contracting or dilating in proper way or not, is the blood is flowing properly through the blood vessels. Okay, so we can go through the echocardiograms in which the sound waves are sent through the heart muscles and chambers and we can record its ECG. Next test is our cardiac catheterization and we can call it as a cardiac angiography. In this procedure, it is a short invasive procedure which is performed in a cath lab, in which a wire is placed through the groin region up to our heart coronary artery, and through that wire we inject a dye. A dye will go through all the arteries, and where there is a blockage it will stop there. Okay, there is a occlusion formation and we can understood that yeah, in that place there is a formation of a clot. Next test is our position emission tomography, that is called as PET scan, in which a radioactive positron is sent to our arteries, and where the radioactive substance traces there, it binds with the blood clot and we can see it in the screen. Next, other tests are like MRI, magnetic resonance imaging. A high resonating images are sent into the heart and we can visualize it. Other is nuclear imaging, which is similar like a position emission tomography, and the test is CT scan. CT scan is sometimes performed with the dye injected. Okay, we can inject the dye with a CT scan and we can visualize our heart and blood vessels, how the blood is going through that. And one more test you can perform for the heart is that is called as blood test for checking our triglyceride, cholesterol and lipoproteins level in our blood. And now discuss about its treatment. First we come to the medical management. Okay, in medical management we can give nitrates. Nitrates are also called as nitroglycerin NTG. These nitrates are vasodilator, which will dilate the blood vessels. Okay, it will open the blood vessels so that the blood can properly flow through it. Okay, it will relax our blood vessels. The blood vessels which get narrow through the blockage, the nitroglycerin help in the dilation of blood vessels, and mainly the nitroglycerins you all guys know that we can give it through the sublingual procedure. Okay. Next come to the cholesterol modifying medications. Okay, LDL, it is modifying the cholesterol, mainly it is decreasing the LDL bad cholesterol. Okay, so it reduces the bad cholesterol. Okay, it help in reduction of the triglyceride cholesterol. Drugs which you can prefer in this condition is statins, fibrates, bile acid sequestrants. Next drugs comes to the beta blockers. Okay, beta blockers itself saying blocking means these drugs are blocking our adrenaline hormone, or we can call it as a epinephrine hormone, because adrenaline epinephrine hormone are increasing the heart rate and increasing the blood pressure. So these hormone will block our hormones, mainly adrenaline and epinephrine hormone. Okay, so blood pressure will decrease and decrease the demand of our oxygen supply to the heart. So in this we can give the drug like atenolol and propranolol. Next drugs comes like calcium channel blockers. Okay, calcium channel blockers are blocking the calcium because calciums get influx in our cell. Okay, so when the calcium will get influx in our heart myocardium cell or our blood vessels, it will contract them. Okay, it will suppress them. So we are blocking the calcium to get influx into our myocardium and blood vessels, so are preventing the calcium from entering the heart and blood vessels. The drug which we can give, that is amlodipine. Okay, it help in dilate the coronary artery and reduce our vasospasm. Next drug is our antiplatelet, which is also called as anticoagulant, means any coagulation formation or any clot formation it prevents. Okay, so these drugs will help in dissolution of the clot or prevent the clot formation. Example like aspirin. If somebody is allergic to aspirin, they can have clopidogrel or ticlopidine. Aspirin help mainly in the thinning of blood. Okay, if the blood will remain thick, there are more chances of getting clot. So aspirin help in thinning of blood, but if aspirin is taken in heavy dose, it can lead to several bleeding disorders. So let's go through now our surgical management. First surgery is our coronary angioplasty. We can call it as a percutaneous transluminal coronary angioplasty. In this procedure, through a coronary artery, a wire with a balloon, okay, a wire with a balloon is inserted into our coronary artery, so that the plaque which is deposited in the walls of our artery gets suppressed through the balloon. Okay, and then immediately we can place the stunt over there, means a wire mesh over there. So coronary angioplasty or percutaneous transluminal coronary angioplasty help in opening the blocked area. Next, open heart surgery, we called it as a CABG, that is coronary artery bypass, or it is called as bypass surgery, because in this procedure we open the heart. Okay, so in this procedure the coronary artery are bypassed. Suppose that you all guys are seeing this diagram. This is suppose our coronary artery, and by chance if there is a plaque or any clot formation, the blood will not able to flow it properly. So we are changing the path of blood. Okay, so why we are changing the path of blood? Because the cells will not get deprived of oxygen and nutrition supply. That is our heart cell, myocardium cells. Okay, so we are changing the path here. We are bypassing the path. Okay, so bypass surgery means we are changing the path of our blood flowing, so that our cell will not able to get die. Okay, so the occluded coronary artery bypassed with the client on venous. In this procedure, what we do? In this procedure, we take a vein or artery from the patient own body. Like we can take the artery and vein from the patient leg or arteries, like from the chest or from the arm. Okay, and we will bypass the path of our blood supply. Next surgery comes atherectomy. The tomy words itself say opening. Okay, so what we are doing here, we through a coronary artery, this is plaque formations, we are opening this and we are removing this plaque. Okay, so the blocked area inside the artery is cut by a tiny device, means through any instrument or through a small tiny device we are cutting this plaque. Okay, so we are doing a hole here and we are cutting this plaque and this procedure is mainly done when your plaque is very hard. Okay, when your plaque is not going through the coronary angioplasty or percutaneous transluminal coronary surgery and through the CABG. So you can do this atherectomy, you can go through that procedure. So in this we can cut the plaque through directional method. If the plaque is in only one direction, so we will use the cutter in only one direction. Okay, and this cutter will cut the plaque. We can have that in rotational. Rotational means when the plaque is in both direction. Okay, then it can rotate and it can cut the plaque. And through the laser surgery. Next comes the coronary artery stunt. Okay, this is a mesh like coil. Okay, this is our coronary artery and this is our mesh which we can place so that this plaque will get depressed here. Okay, and sometimes this stunt, this mesh release a medication. This medication released by this mesh can help in the dilation of our artery. Not the least, most important for us is nursing management. So as a nurse, what you can do, you can obtain the patient BP, you can check his apical rate, respiration rate, and you can go through his physical or BP measurement. Okay, next we can do the most symptom, as you know that in heart disease, is our chest pain. So our utmost important main focus is to relieve the patient chest pain. Okay, it's our duty. So we can write down how much patient is feeling the pain, what episode he is going through, how much time he is having angina. Okay, we can all note that and we can read through that. Teach patient about quit smoking. As a nurse, you can guide the patient, please just quit off all the bad habits like smoking, alcohol and tobacco smoking, everything. Next is our tell patient about increased activity level. If patient is obese, he is having high triglyceride and cholesterol level, he is having sedentary lifestyle, we can teach him about the lifestyle which is very active. Okay, next, eat patient a heart healthy diet, in which you can guide the patient to have a green leafy vegetables with a lot of water supply and some good amounts of cereals you can include in his diet. If the patient is not getting a sufficient oxygen supply, he is not getting sufficient breath, you can give him a Fowler position to promote his ventilation in a better way. Okay, administer patient oxygen if your doctor have prescribed and patient is feeling dyspnea, and if doctor and physician have prescribed about the ECG, you can have his patient 12 lead ECG. Okay, thank you so much guys. If you please like my video so you can subscribe it or like it. Thank you so much guys, love you all.